Now that you finally feel like you understand Medicare overall and supplements versus Advantage plans, you're probably wondering, what do I do? What is the right option for me in my unique situation? In this lesson, I'm going to go over a fun analogy I made to help my clients choose the right option for them. Imagine you were going to buy a boat, and before you took the boat out onto the water, you wanted to make sure there were going to be no holes in the boat so that you weren't going to be sinking. Product number one is called Super Sealer. It's a one-time fee every year of $3,000. Now product two on the right side is Leak Patch Tape, which is $50 per piece of tape you use. So with the Super Sealer, you know that there are going to be no holes in the boat throughout the year, but you're going to pay $3,000 and you're going to have to reseal it every single year. With the Leak Patch Tape, on the other hand, you will patch holes as needed, just as effectively, but you'll only pay $50 every time you need a piece. Now, as you could imagine, not all boats are created equal. A flimsy little raft is not the same as a yacht made of steel and aluminum. So if you had a raft and you felt like you were more susceptible to holes, you might want to do the Super Sealer to make sure you'll be covered no matter what. If you had a nicer boat, you might opt for the Leak Patch Tape because you're pretty confident you won't have a ton of holes in the boat, but if you do, it's only $50 per piece. So you might be wondering, what does this have to do with Medicare? The Super Sealer is kind of like a supplement plan, while the Leak Patch Tape is kind of like an Advantage plan. Usually, good candidates for a supplement plan are people with tons of health issues, people who don't mind spending more money, people who do not want to deal with networks at all, and those who really want a predictable budget over all else. Good candidates for Advantage plans, on the other hand, are people who are somewhat healthy, who want to save money on average, people who like extra benefits like dental, vision, hearing, and so on, and people who understand co-payments. Even though you're starting off at about $0, when you go and seek services or patch a hole, you're gonna pay a small amount. But the bottom line is, even though I'm trying to arm you with all this information about Medicare, I still would not recommend you choosing a plan for yourself without the help of a professional. I know that Medicare is incredibly confusing. I hear it multiple times a day from my clients. And I tell them that's why I have a job. It's my job to help simplify the whole process for you. However, if you want to start checking out supplement and Advantage plans in your area, I am licensed to sell some of the top providers in the entire nation. And if you click on resources 7 and 8, you can see supplements and Advantage plans that might be best for you. Also, if you want to see the form I use when I start out with my clients and ask them questions and try to direct them where they need to go, check out resource number 9. It's a one-page sheet I call the Client Preferences Sheet. If you start by filling this out, it'll give you some good directions when you actually check out plans to see what you're looking for. So if you actually go to the resources to start looking at plans, you can enter your zip code and you can actually see the plans that I'm licensed to sell in your area. Then you can add your preferences, so you can choose medical and drug coverage. You can add your general health needs, your age, your medical costs. You can actually estimate how many services you might need. You can add your doctors, your prescriptions, your pharmacy, and so on. Once you have added your preferences, this platform will actually give you a cost summary. You can sort by total annual estimated cost to see what these plans might cost you overall. That was a quick analogy to show what kind of people are best with supplements, what kind of people are best with Advantage plans. In the next lesson, I'm gonna give you 3 free gifts for people around the age of retirement to help you live a more stress-free life. And I'll also tell you the next steps I would recommend you take with Medicare. As always, I'm Braden, a licensed insurance broker, certified with some of the top insurance providers in the nation, like United Healthcare, Health Alliance, Humana, Aetna, Blue Cross Blue Shield, and Wellmark. And if you decide to work with me, there is never a fee for my service. I'm only paid if I keep my clients, which means that their satisfaction is my priority, and I offer face-to-face, year-round service. Whenever you're ready, click the button below to continue to the next lesson, where I'll give you my 3 free retirement gifts and tell you the next steps you should take with Medicare.